To answer question number one, I would describe the communication between the provider and the patient a little bland. I feel like going further into communication when it comes to a patient explaining what they're feeling, it's quite important to let the patient speak so that the provider can really listen what is going on. For the second one, how did the provider's interruptions contribute to gathering information? I feel like the provider constantly interrupting the patient refrains the patient from actually explaining what truthfully is going on. At this point, the patient starts avoiding information or doesn't explain all the way. Therefore, it's kind of hard to get a diagnosis or even get a bad diagnosis in this case. For number three, I don't think the students were able to learn anything about communication. I feel like the provider just followed a basic script on patient screening, and the students don't really learn from this because it's not actual communication with the patient. It's just asking basic questions. You're not even listening to what the patient is saying. For number four, describe the provider's nonverbal behavior. I feel like the provider came off as snarky to what I read, and I feel like this kind of makes his role seem a little superior, and this doesn't really build that confidence with the provider-patient relationship, and it's extremely important to be able to communicate correctly with your patients. That way, your diagnosis and everything that you may be able to gather and put together is as accurate as possible. For number five, what verbal communication from the patient would you have expanded? So I truthfully believe that the patient could go further into detail with how they are feeling. Going into detail more is extremely important when it comes to patient communication. Everything that the patient says can be taken into effect and can be used to correctly diagnose what truthfully is going on. You see, like at the end, he asked, "So do you have an idea that what I have?" Well, the doctor can't really say anything because he didn't really listen to him. He didn't listen to him over his symptoms. He didn't listen to him over what he did or what he was doing, what he was taking. All he was just asking him was basic questions of overall health. For number 6, what verbal communication from the provider would I like to change? I feel like as a provider, you have the job to really listen to people. You work in a field where everything is word of mouth. You have to believe what a patient is feeling over their communication. Like, you can't just say, "Oh, well, you don't look like you're in pain, so I'm going to assume that you're not." That's not how it works. In the medical field, you have to listen to what a patient is feeling, listen to what they have been doing, listen to what they have been taking, eating, whatever. So I feel like as a provider, maybe listening more could be beneficial to both provider and patient. Number 7, identify 3 or 4 behaviors that would help enhance. So number 1 is obviously listen to your patient. Let your patient speak on what they need to say. A second one would be try to build a relationship. Try to build that confidence with your patient. Really hook them with what you're trying to do. Hook them in your professionality and show them that you know what you're doing, that you're good at your job. A third one would be always be kind. I feel like being kind comes a long way, especially in this field. You could have a long-term client, 5+ years, always treating them, but you stop being kind and this client will go somewhere else. In the medical field, it's all about how we are treated. If you're mistreated, I promise you, people will not stay with you. I wouldn't stay with somebody that mistreats me, especially if I'm paying for these services and if I want to better my health. It's extremely important to treat people with kindness. It doesn't matter if you're a doctor, nurse, medical assistant, CNA, whatever the case may be. Always be a kind person. And the last question, why is an interpersonal relationship important to provider-patient interactions? An interpersonal relationship is the most important thing you can build with your patients. Once you build that interpersonal relationship, you have access to their entire confidence. They know they can trust you. They know they can tell you what truthfully is going on in their life, and they'll refrain from lying to you. Patients lying to their providers or to their nurses is one of the main reasons for misdiagnosis. So you have to build that confidence, build that comfort around them. And this is why it's extremely important to build an interpersonal relationship. Make them feel like they can trust you. Make them feel accepted and welcomed to your environment, to your practice, to your hospital, whatever the case may be.